And that brings us to the interventions. As you review these interventions, which are a team effort, let's summarize the nurse's role. You'll recognize cardiac arrest and take immediate action. You'll call for assistance, whether you're in a community setting or a care facility. You'll initiate basic cardiac life support and ECG monitoring. Nurses defibrillate as needed and insert an airway. You'll establish venous access and administer drugs as prescribed per protocol. It's your role to evaluate the client's response to treatment, to monitor the client closely after resuscitation, and to explain the situation both to your client and the client's family. Can you describe an attack of angina? Angina pectoris, or simply angina, is usually described as a burning or squeezing substernal pain. Radiation to the arm, shoulder, jaw, neck, or epigastrium is common. Remember that not all clients who have coronary artery disease, or CAD, have pain. For some, the only subjective manifestations are excessive fatigue and exercise intolerance. But most clients who have angina have pain, and sometimes dyspnea, tachycardia, nausea, vomiting, pallor, and diaphoresis. What about angina pain in your elderly clients? Elderly clients might not experience pain or as much pain, possibly because they have developed collateral circulation. And clients who also have diabetes mellitus might have central neuropathy, and if they do, they may not feel much anginal pain. There are 4 types of angina: stable, unstable, intractable, and variant. Stable angina is characterized by the onset of symptoms in situations that increase the heart's oxygen demands, such as physical activity or emotional stress. Rest usually brings relief by decreasing oxygen demands. If rest alone does not relieve symptoms, nitroglycerin is often effective.
Nitroglycerin is a vasodilator that acts on coronary and peripheral vessels. Sublingual tablets and spray are available for PRN use. Nitroglycerin can be taken shortly before strenuous activities to control symptoms. Patches, ointments, and sustained-release tablets are used to prevent angina episodes.
Unstable angina is also a result of increased myocardial oxygen demands. It differs from stable angina in that it becomes progressively more severe and occurs more often. Intractable angina persists despite rest and usual treatments and can be incapacitating. Variant angina, also called Prince-Metal's angina or vasospastic angina, is different in that it is caused by coronary artery spasm. Symptoms typically have a longer duration than those experienced with stable angina do. This is a good time for a brief overview of CAD. Coronary artery disease is a narrowing and obstruction of the arteries that carry oxygen and other nutrients to the heart muscle. It is the leading cause of death in the United States. CAD is usually due to the buildup of plaque in the walls of the coronary arteries. Plaque is a kind of sludge made up of fat, cholesterol, white blood cells, calcium, decaying tissue, and other cellular garbage. Wear and tear inside the blood vessel walls create rough spots on which plaque can catch and build up, eventually blocking blood flow through those vessels. This condition is called atherosclerosis, the most common form of coronary artery disease. Diagnostic test results that support a diagnosis of CAD include a serum lipid profile with elevated cholesterol, triglycerides, and LDLs, and low HDLs. A good memory cue is that LDLs are lethal and HDLs are helpful. Characteristic findings on ECG and evidence of coronary artery occlusion on cardiac catheterization also help with medical diagnosis.
The primary drugs used for CAD are antianginals, antilipemics, and low-dose aspirin. The aspirin is taken to prevent thrombus formation. Among the drug classes used as antianginals are nitrates, primarily nitroglycerin, calcium channel blockers, and beta-adrenergic blockers. As we discussed before, nitroglycerin is a vasodilator. Sublingual tablets and spray are available for PRN use. Patches, ointments, and sustained-release tablets are used for prevention. Isosorbide dinitrate, trade name Iserdil, is also available in rapid-acting forms, specifically sublingual and chewable tablets, and in tablets for preventative therapy. Calcium channel blockers, such as nifedipine, trade name Procardia, dilate coronary and peripheral arteries, thereby increasing myocardial blood flow. Peripheral vasodilation decreases cardiac workload by decreasing preload and afterload. Beta-adrenergic blockers, such as atenolol, trade name Tenormin, decrease heart rate and cardiac output, thereby reducing myocardial oxygen demands. They also dilate peripheral blood vessels, which reduces blood pressure, preload, and afterload. Because antianginals generally dilate blood vessels, what kind of adverse effects should you anticipate? Expect hypotension and bradycardia. With calcium channel blockers, they can be rebound tachycardia or fluid retention. And with beta blockers, there's congestive heart failure.
Let's review nursing assessment for CAD. First, pain. What would you want to know about the client's pain? How about the nature of the pain, location, precipitating factors, and relieving measures? What vital signs are important? Heart rate, blood pressure, and respiratory rate. How about the client's medication history, such as which drugs were prescribed to treat CAD or angina, and are they drugs that might cause or aggravate other symptoms? For example, if the client is taking beta blockers, watch for signs of CHF, such as edema, dyspnea, and weight gain. You'll need to know the client's height and baseline weight as well. Nursing diagnoses for clients who have CAD vary with the severity of symptoms, but what might they include? Activity intolerance, anxiety and fear, decreased cardiac output, acute pain, self-care deficits, and knowledge deficit. What interventions might help these clients? Teach the client who has activity intolerance to schedule periods of rest, plan activities when feeling best, and stop activities immediately when dyspnea or pain develops. Help the client who lives at home to redistribute tasks among others living in the home. And encourage your client to decide what is really important and what can wait or be ignored. Chest pain, dyspnea, and activity intolerance create anxiety and fear, and anxiety aggravates CAD symptoms. What can you do to reduce your client's anxiety? Be accepting of the client's anxiety and fear, and explain the basis for CAD symptoms and how the client can manage them. Relaxation techniques might also help. Cardiac output may drop with CAD because myocardial contractility is affected by poor perfusion. In addition, antianginal drugs can suppress myocardial contractility. What are the implications of decreased cardiac output? The client might have an injury related to orthostatic hypotension, and circulation to vital organs could be impaired. Acute pain is actually a protective mechanism. With angina, it is a warning that the myocardium lacks sufficient oxygen. Chest pain or the anticipation of it can be frightening and can make clients restrict their activities severely. Teach clients that angina can usually be managed with modification of activities and drug therapy. What guidelines for using PRN nitrates should you include in your teaching plan for the client? Advise him to keep some nitroglycerin sublingual tablets or spray with him. He should also protect nitrates from heat and moisture and not keep them next to his body. Tell the client that nitroglycerin tablets should sting slightly underneath the tongue. If they do not, he should obtain fresh tablets. As soon as pain occurs, he should stop what he is doing and place one tablet under his tongue or spray once onto or under the tongue. He should note the time and avoid smoking, drinking, or eating right after taking the nitrate medication. If pain persists after 5 minutes, he should discard the first tablet and place another under his tongue. The dose can be repeated one more time if needed after another 5 minutes. If pain persists after 3 doses, the client should be transported to an emergency department because he might be having a heart attack. One more point. Before more strenuous activities that tend to trigger angina, like exercise, he can take sublingual nitroglycerin